All right. Hello, everybody, and thank you for joining in. I'm Tosi, one of the co-founders of Criado and the program director, and I'm really excited to have a special guest here today. So, I'm gonna give you a little overview, okay? And you'll see why this overview is kind of easy for me. Ladé Adeniyi grew up in Illinois and attended UMass Lowell, where she played Division I volleyball. After graduating, she worked at Boston Children's Hospital before pursuing her dream of becoming a dentist. Now in her fourth year of, oh no, in her third year, almost fourth, of dental school, she has been actively working on patients and honing her skills in clinic. Beyond dentistry, she's passionate about Afrobeats, the ocean, and Avatar: The Last Airbender. And most importantly, she's my lovely sister. Hardworking, compassionate, and dedicated to making smiles healthier every day. Hello, Lottie.
Oh, wow. What an introduction. Hi, everyone.
How you doing? How's life?
I'm doing good. Wow. I feel so special with that intro. I do love Avatar. I did work with Boston Children's.
It's
I am
correct.
dental school. Yeah.
I love it. Okay. So, first, I want to dive in and just ask a little bit about you for the people in our community or throughout the world who may not know you. So, can you please tell me a little bit about yourself and your journey to dental school?
Yes. Wow, this is bringing me back to interview season. Tell me a little bit about yourself. Love
Right?
that. Well, I'm gonna first start off with my journey to dental school. It's a bit of a roller coaster, but it's an exciting one. Um, like Tosi mentioned, I went to UMass Lowell and I played volleyball. I didn't know I wanted to be a dentist when I was in undergrad. I knew I wanted to do something in the sciences, and I knew I wanted, at that point in time, I wanted to do medicine. I wanted to go to medical school. Um, Juggling the prerequisites and Division I volleyball was really challenging. Um, and I kind of had like a aha moment where it was like, are you sure this is like what you want to do? Are you triple sure? But that came later. That came after I graduated. I switched my major second year to public health. And public health, for the reason for that, there's nothing wrong with biology. There's nothing, that having hard science foundation is super important, but I wanted to take that a step further, and actually learn how that applies to communities, and real life people experiences. So I changed my major to public health my second or third year of undergrad. I can't remember. One of those years. And it was the best decision I've made. And the reason for that is because being in dental school now, I still carry a lot of what I learned in public health, into my daily activities with interacting with patients. Anyway, flash forward, fourth year of undergrad, I graduated and I got a job working at Boston Children's. I worked in the hematology oncology department, looking at rare blood disorders. So,
Not
um,
heme and onc. Heme and
I know
onc.
heme onc. Um, I was more so on the side of working with children that had sickle cell disease and um, hemophilia and pyruvate kinase deficiency, a lot of really rare blood disorders. I did that for 3 years. And while I was there, I had the opportunity to work at an amazing hospital with so many different specialties. And I was like, I don't think I want to do medicine, but I still want to be in science. I still want to be in healthcare. So I literally shadowed everyone, like nurses, respiratory therapists, like anyone in the hospital, you name it. I sat with them, I talked with them, and I was like, "Tell me about your day to day. Like, do you like your job?" Dentistry popped up, and I think that was the another aha moment where it was like, "Oh my God, I get to combine science and creativity. Like, how rare is that?" It was so amazing. It immediately clicked with me. Um, and at that point in time, that was the moment for me where I was like, okay, I'm going to pursue this. I'm going to put everything into this and just see where it takes me. And
Mm.
here I am.
Yeah, can you say a little bit more about creativity? Because when I think of dentistry, I may not think of creativity. So can you
Yeah.
so what do you mean? What do you mean that you get to combine that? in dentistry, science and creativity?
That's a great question. I didn't know that usually when you think of dentistry, that's not the first thing that comes to mind. What I mean by creativity is there is such an art to creating, if for example, if a person is missing a space in their mouth and it's like their aesthetic zone, and every time they smile, you see that missing space. As a dentist, it is our responsibility to match what that previous tooth or kind of come up with how that space will be filled, meaning the color, the transition of, opacity, however you pronounce that, and translucency, color matching. That is huge. Like imagine, for example, I don't know, you went on a sledding trip and you knocked out your two front teeth, and then you're relying on a dental professional to create a smile for you essentially that you're happy with, and you as a dentist get to choose that, the color, the shape of the tooth, the way that it matches their arch form, the level of the gingiva.
Yeah.
Like it's really creative, and it you have science, but you also have a little bit of artistic input, which is really really fun. So
That's awesome. No, that's cool. I don't know. I feel like I just thought that, you need a tooth to just pull one from the shelf and
yeah,
just
and you just pluck it
pop it
in
in.
there.
Right?
I
I didn't,
know.
yeah,
Trust me, I wish it was that easy, but
that's
it's
wild.
lighting too, depending on the lighting of where you choose the color and how you smile. The lighting plays an effect. So there's a lot of fun. There's a lot of creativity.
Yeah. Okay. I have one more question just about like who you are,
Yeah.
and then we'll get into a little bit more cool things. So, can you tell me what is one myth about dentists or dental school that you would like to debunk right now?
Oh, all spotlight on me. Um, I want to start off with a myth that I want to debunk about dentists or going to the dental office.
Let's hear it.
I think pretty well known that people don't really like going to the dentist. It's associated with discomfort or like the weird scratching noise that you hear when they clean your teeth.
Yeah.
Yeah. So, but I think the main theme is people associate dentistry or going to the dentist with some type of pain,
I was
which
gonna
is,
say with pain.
yeah, I mean, historically, dentistry has come a really long way, but I will say, depending on what procedure you're doing, dentistry does not have to be painful. It really doesn't. And
Mm.
a lot of it, the reason why I say that is um, a lot of why dentistry is painful is because, from what I'm assuming, is people getting numb and getting that initial shot to numb your teeth.
Those
Um,
always hurt.
I know those always hurt, but there's ways to kind of distract and kind of do that without being painful if your dentist is knowledgeable and has experience
Mm.
in control. I have a whole class. I've had two classes in separate years completely dedicated to pain control, where we learn all about the nerves and where to properly infiltrate or do a block. It doesn't have to be painful if your dentist knows what they're doing. I've been to a dentist.
That's
Yeah,
that's the thing right there. If they know what they're doing.
if they know what they're doing.
Yeah.
Yes, that's the challenge. So
Okay.
that's one myth I want to debunk.
Okay. I
Yeah.
love that. No, I love that. I want to get into a little bit more about women and birthing people and their teeth because our Criado community is a bunch of birthing people. Sometimes their partners come and check it out, but I want to know, how does oral health specifically impact women's overall health? Like, I feel like it's not seen as that important, and I want to know your thoughts on why and if it is that important.
Yeah. Well, I'll be the first to say it is so important. The way that I like to describe the oral cavity to my patients, if they have a confusion between, connecting their oral cavity to their overall health, is the teeth are like the gateway to the rest of your body. And a lot of different, and the reason why I say that is because when I look into a person's mouth, there is a whole story to be told there. It's a landscape. I'm
Hmm.
looking at the gingiva or the gums. Are they inflamed? Is there any lacerations? I'm looking at the lips. Are they competent? Meaning, do they fill the fold correctly, or do they kind of like fold inward? I'm looking at symmetrical. I'm looking at their symmetry. I'm looking at
Mm.
the tongue. Is it coated? Is it not coated? Is it pink? Is it white? I'm looking at so many different things. And it kind of paints this, I would like to say, this beautiful story
Okay,
of
come on,
someone,
dentist.
come on now. It paints a story of kind of their life too. I have patients, that are 30s and 40s and they don't have their teeth. That can say a lot about their diet, the stresses they may have faced growing up, maybe a lack of oral hygiene. But to answer your question of how does the oral cavity um, kind of relate to someone's overall health, it's the gateway. I mean, you can see everything. You can see someone's diet. Are they eating healthy? Do they eat a lot of sugary things? Or, do they need some more calcium? Is things hypomineralized? I mean, like I can go on and on. I don't want to bore
Yeah.
everyone, but the point of why I'm saying this is it's a gateway to someone's overall health, and it can oftentimes be the first place that systemic diseases can be identified. And a lot of dentists can have been the first to diagnose cancer, just
Mm.
looking at the oral cavity, like leukemia. Oh
Wow.
yeah, and I didn't know this whenever I whenever I got into dental school. I didn't know all of the different oral manifestations that can show up in someone's mouth first,
Yeah.
or even even before a PCP may identify it. And yeah,
Yeah.
I can go on and on about
Why?
that. But
I was gonna say, why do you think that that is? Like, why is your mouth kind of the magnifying glass of
mm,
what may be going wrong in your body? That's kind of what I heard. Why? Like,
yeah,
why?
I so the first thing that comes to mind is just the sheer vast different types of tissues is what I'm trying to get at that are in your body.
Mm.
For example, when the example I brought up about leukemia, there is, not to get too scientific and say all these big words, but there
Yeah.
are molecules that usually are associated with inflammation, or maybe is indicating that a certain cell type is growing out of control, which is, a type. It's kind of like what leukemia is happening, what's happening in the body, and
Mm-hmm.
that best in the oral cavity. You have connective tissue, you have epithelial tissue, you have
Ah.
all these different types of tissues that are joining together, and um, it's that's the gateway. It's what you eat. I don't know. It's
Yeah.
my way. There's so many different types of tissues, and they all interact and interchange. And you can kind of see it first in the oral cavity.
Yeah. No, that makes sense because as you're talking, I'm like feeling my cheek. I'm feeling like
Yeah.
I'm feeling everything in my mouth. And
Have
I never
yeah,
thought of it like that because certain parts of your body are only made of certain tissue. Is that right?
yeah,
But your
yeah.
mouth has multiple different tissues.
All different types. You've got bone tissue, you've got connective tissue, you've got epithelial
Oh,
tissue.
that's kind of cool.
Yeah, so you can kind of, for example, in for diabetes too.
Mm,
Diabetes has a huge manifestation in the oral cavity, and a lot of times people don't even know they have diabetes.
yeah. No,
Sometimes they don't
literally.
know it. And so like someone will come in and their gingiva is inflamed, and you're like, have you gotten any blood work
Gingiva
done?
is the gums.
Sorry, yes, the gums,
Okay.
sorry. The gums are like inflamed, and in diabetes, there's an increased number of like inflammatory mediators that happen, and a lot of
Mm,
it can be seen in the gingiva. And so oftentimes I've had examples where I'm like, hey, like, you these look really uncomfortable. Your gums look really uncomfortable. Like, have you gotten any blood work done from your doctor? And sometimes they're like, oh, I haven't seen my doctor in 30 years. And I'm like, well, maybe
Wow.
I would really recommend you go get some blood work because that might be a bigger issue. And then hopefully that prompts them to go see their doctor and get
Yeah.
identify what's happening.
That's so interesting. That kind of goes into my next question. How do um, hormonal changes? So I know you talked about diabetes. This isn't a hormonal change, but I'm thinking of like changes within a woman's body or a birthing person's body. How does that stuff, pregnancy, menopause, menstrual cycles, affect oral health? Or does it affect oral health at all?
It does. Being a
Let's
woman
get into it. Let's get
Being a
into
woman
it.
is hard. There's
Okay.
so many changes. There's so many changes that are happening in your body. And I don't mean that being a woman is hard, but I think that there's so much that we can adapt to in our as being a woman, there's so many changes that happen
Mm.
um that we adapt to. And for example, let's start with what do you want to start with? Pregnancy maybe? Or
Um, can we start with menstrual cycles? Because that
yeah,
sometimes happens before pregnancy.
yeah, menstrual cycles. Okay, so when you are having a menstrual cycle, there's an increase in like estrogen and progesterone. Um, and those hormones often accompany other like inflammatory mediators, which can cause your gums to be just a little bit more inflamed. And what
Mm.
people don't realize too is like your body has like a closed circulatory system. So every blood vessel that reaches the tip of your toes is
Yeah.
all to reach your teeth. It's all connected. So,
Mm.
the hormones that are pulsing through maybe your pancreas or that reach your toes eventually, like it's gonna
It's
come,
gonna reach your
yeah, it's gonna reach your mouth. It's all
um
closed. It's not like an open system where like obviously there's um, you know, I don't want to again, I'm not gonna get too scientific here,
yeah.
but hormones pregnant or not pregnancy, hormones and menstrual cycle. So if, for example, if someone notices, they're about to start their period and for some reason when they floss, their gums feel extra sensitive, or maybe they
Mm.
bleed a little bit more around their gums, and that usually doesn't happen around their period. That could be a response to an elevated levels of progesterone and estrogen that have accompany inflammatory mediators. So it's not
Wow.
something to necessarily like freak out about, but it's just something to like take note of. If you're doing your oral hygiene, you're like, huh, I wonder why my gums feel extra sensitive right now.
Yeah.
It's hormones from your period. There's a surge.
Wow.
Yeah, so it's not like and a lot of dentistry too is preventative.
Mm-hmm.
Everyone gets everyone's like, I don't want to floss, I don't want to brush my teeth, but
Listen.
the more you do it, the less it hurts.
Yeah.
Throwing that out there. Just
Okay,
throwing
Dennis. Okay, so we all need to floss. Heard,
it.
heard.
Um,
Um,
yeah. So
no, that's really cool. And I think it also helps me realize because at Criado, at least what I'm really, really passionate about is hormones and balancing hormones. And we are also super passionate about being proactive versus reactive. And
yeah,
what I'm hearing from you is if we take a proactive approach to our overall health, i.e., seeing, learning about our hormones, learning what can balance the hormones, learning what can throw off our hormones, we will have an overall comfier life, even down to our teeth when we're flossing.
absolutely. Absolutely.
Yeah.
Yeah.
No, that's
And
awesome.
and I think that's one thing too that um people don't understand how connected everything really is.
Oh my gosh,
Um,
wait, what's the show? It's all connected.
it's all
What's
connected.
that show?
I don't
The
even know.
the flight show where everything crashes and then they're
Oh,
magic.
manifest?
Man,
Was it
it's all
manifest?
connected.
It's all connected.
Yeah.
It's all connected. Like I'm being so serious. Like it really is all connected.
Yeah.
And yeah, it's just very interesting to see how, when your body changes, so does the oral cavity. And some things are not to
Mm.
be too worried about, like with the
Yeah.
fluctuation of being pregnant or being on your menstrual cycle.
Yeah.
It's a roller coaster, but yeah.
Can we talk a little bit about pregnancy next? Because
Yeah.
like I have baseline knowledge. I'm not a dentist, but I know sometimes people's teeth, like you said, will bleed when they're pregnant and they don't know they're pregnant yet or something like that. Is that going
Yeah.
back to like the hormonal shifts?
Yeah, yeah. So when someone, first gets pregnant, there's like a whole change in the hormones that are being like surged in your body to prepare for the baby.
Mm-hmm.
Um, and like I said before, some of those hormones are progesterone and estrogen, and other hormones that accompany like inflammatory mediators. So when someone is pregnant, and there's a whole other slew of hormones
Mm,
when a woman becomes pregnant, and a lot of those, what I guess piggyback off of them are inflammatory mediators. And when I say inflammatory mediators, I mean like these tiny little cells that um, find their way into the blood system. And then, of course, we're in a closed system, so it's not like the blood that reaches your toes isn't going to reach your teeth.
mm,
It eventually reach
yeah.
your teeth. And when you think about um, blood and vascularity, your gums are the ones that's the most vascular. If you think about it,
Vascular means
meaning there's like blood vessels that reach them.
okay. So the most is there.
Yeah, you have a lot of blood vessels. Like think about it whenever you like, I don't know if you've experienced like when you cut your gums, like it
Yeah.
it bleeds.
Oh yeah.
A lot of blood vessels there. So that means all the like molecules in your blood, it'll eventually reach your gums. And
Mm-hmm.
um, that can kind of trigger, if you have high estrogen or progesterone because you're pregnant, um, that all of those hormones are going to reach your gums. And if you if you don't brush properly, if you don't floss properly,
Mm-hmm.
there's bacteria that like to like hide in the crevices,
Mm-hmm.
and they form what's called plaque and calculus, and it's like this whole like microorganism of bacteria that kind of house in
Mm-hmm.
between. I know this is kind of getting a little bit gross, but
That's okay.
that's
I
what happens.
no, that's what it is. I have another question. So, is this, first off, is this a myth or fact that oral hygiene is more important when you're pregnant as a woman?
I don't like the word more important. I
Okay.
I I almost want to say it's I would say maybe more can go a little bit more wrong if you're not taking care of it. So
Okay.
if you are good at brushing twice a day, if you're good at flossing at least once a day, um, and you're pregnant, there you there's less chance that you can develop issues with your oral cavity.
Mm-hmm.
So, but for instance, if you're not that great at brushing and you're not that great at flossing, and then
Mm-hmm.
you get pregnant, the hormones that are surging through your body can exacerbate the already poor hygiene that you're doing at home. So, is it more important? I think oral hygiene, period, is important. But if you're pregnant and you're really not doing good about brushing and flossing, it can cause a little bit more issues down the line than if
Yeah.
you're about it, if that makes.
Okay. Yeah, no, that makes sense. I was also thinking, just like based on my knowledge about when you're pregnant, how your blood is your baby's blood and the placenta and
Ooh, I have a mm-hmm.
okay, go
I
off.
have I have something to say
Go
about that.
off. Go off.
So you know how like for example, you are watching your baby and they're, you know, they drop their favorite toy or
Mm,
their pacifier. Let's use a pacifier, for example.
okay.
Sometimes what moms will do, and I don't want to throw any shade because I'm sure one day when I become a mom, I'm probably going to do it too.
Yeah.
But you drop the pacifier and you're like, oh crap, I'm not near a sink. Let me just like quickly lick it off real quick and just like wipe it off and just put it in their mouth. Moms
Yeah.
do that.
Yeah,
I,
no,
I'm
it's a
not,
thing.
I'm not here to
It's a
judge.
thing.
One thing I want them to keep in mind though before they do that is the bacteria that's in your mouth can be passed on to your baby. And there are specific bacteria that we call it like the red complex, orange complex, green complex, yellow complex. There's like a I know. I feel like
The
I'm getting
rainbow of complexes.
the rainbow of complexes that are
Yeah.
associated with gum disease. And
Mm,
um so if a mother accidentally just like licks the pacifier and gives it back to the baby, like, oh, it's my baby, like the baby shares me, it's not a
yeah.
problem. There's a chance that you can pass those, if the mother is having like active gum issues or gum disease, you can pass those to
Mm.
your baby inadvertently.
Oh, that's
So
good to know.
it is good to know. So maybe not, because like you almost have to think about gum disease as like it's a transferable, like a cold, if you,
Really? I had
oh yeah,
no idea.
oh yeah,
And
if
what's
you,
gum disease? Is that just when your gums are bleeding?
this is crazy. I just had an exam on this.
Okay, let's hear it.
So gum disease, what we call it is periodontitis. So I'm going to refer to it as gum disease.
Okay.
Um, Gum disease is when basically your teeth are like housed in this like bony apparatus essentially, and it has these specific fibers that connect to your bone and connect to your teeth. So gum,
Mm-hmm.
when you start losing that bone, that structure that holds
Mm-hmm.
teeth into place. And what happens when you have gum disease is like the bacteria and all these harmful microorganisms can find their way into what's called the sulcus. And the sulcus is basically an entryway into the housing that holds your teeth in place. So the bacteria, excuse me, I love peds, so I'm going to talk about it in like peds terms, but they have like a bacterial party and they start eating away at what holds your teeth into place. Um, and that can cause like a whole slew of of issues. The first indication is bleeding. So if you notice, when you floss and when you brush, your teeth are bleeding. That's just a reaction to the bacteria kind of not eating away, but having a party inside your gums, and so they're
Yeah.
causing that super strong bone to kind of recede, and then you lose the housing that's holding your teeth in place. So that's gum disease. It's yeah, to keep it like baseline. That's what
Yeah.
happens.
Okay. Okay. And so you're saying a fun fact, it's not that fun, but a fact is that if when you have gum disease, this is bacteria within your mouth, and if you have a baby, you can actually pass this to them by like if your saliva touches their saliva type of thing.
Yeah,
Oh, that's good
yeah.
to
So,
know.
so if a mom is actively dealing with gum disease and
Hmm.
it's specific bacteria
Yeah.
in gum disease. It's not just any bacteria, it's specific bacteria
Yeah.
that find their way into what's called the sulcus around your teeth.
Hmm.
And those specific bacteria cause gum disease. And if a
Got
mom,
it.
is licking a child's pacifier and is dealing with active gum disease, they can inadvertently transfer those specific bacteria to their child who
Yeah.
don't have teeth. Even
Yeah.
teeth.
Oh, that's so interesting.
Even if they don't have teeth, it's just like anything. Like if you were to get a cold, just
Yeah.
because, you know,
Just because
you
you're a
say,
baby doesn't mean you don't get a cold.
yeah, you still
Babies
get a
get all the
cold.
colds.
Oh yeah, they get all the
Yeah. Okay. So I want to take a journey off of like the mom baby thing because I know I can get a little caught up in that because that's my world. But can you talk about the linkage between stress, mental health, and oral health? Is there
Mm,
direct linkage or are there any manifestations that happen when you're stressed?
yes, I'll just flat out say yes. And
Okay.
oftentimes, there's a common theme in dentistry with a lot of other diseases is inflammatory. Um,
You've been saying inflammatory a lot. Is it is
oh
it's a
yeah,
lot.
It's a lot. And I
Yeah.
think the reason why I feel that um inflammatory mediators have such a important role in the oral cavity is because um well, when you think about it, okay, let's just back up a little bit. When you think about inflammation, and I don't want to forget your question, and the
Okay.
question is stress,
Stress, mental health,
health, and how that can manifest in the oral
or
cavity.
does it manifest in your oral
Does
cavity?
it?
Like, yeah.
Okay. Okay, so let's just talk about stress first. So with stress, um, oftentimes you have increased levels of cortisol.
Mm-hmm.
Uh, with increased levels of cortisol, you have a whole slew of other inflammatory mediators that um, can have an effect on your body, including the oral cavity. And um,
So, in like simple terms, stress causes inflammation.
yes,
Inflammation equals issues for your mouth.
exactly. Exactly. And
And
the way you think about it is like it's your body responding to stress. Your body is like, oh
uh,
my God, like I have this exam due, I have to cook dinner, I have to go to the gym, I have to call this friend back, I have to like it's responding to outside external things and
yeah.
what your body knows how to do. It's like, okay, let me like send these inflammatory cells and they know what to do. They'll eat up all the bad bacteria. They'll help you restructure
Mm,
the connective tissue. Like it's just it's yeah, it's all connected, like in manifest.
it's all connected.
Yeah, higher cortisol. Like I said before, closed blood system, everything that flows throughout your body is eventually going to reach your teeth and
Yeah.
cause issues. So maybe you're stressed out because I don't know, like your body's like, "Oh my God, her blood sugar's super low. We got to put we got to make this shift." And
Yeah.
then it's just all connected is what I'm trying to get at. So
Yeah.
yes, if you're stressed, if you are struggling with mental health, and anxiety and depression, which I think all of us are to a certain extent. I know I
Mm,
am
mm,
being in dental school. Um, I've noticed changes in my teeth. I've noticed,
really?
hmm yeah,
Like what?
I like,
If you want to share.
oh, of course I want to share. Like grinding and we
Mm,
call it nocturnal bruxism if you want to be fancy when you don't even know it like when
grind,
you
you're right. Grinding is a stress thing. Like I remember my dentist used to tell me I need a guard because I'm clenching my teeth at night,
yeah
and
yeah
that's a manifestation of like stress. That's so true.
yeah yeah so my teeth like I we have these things called wear facets that if that happens when you like grind at night. And that's one thing too. Like I said, dentistry is like when you look at someone's oral cavity, you can see like a whole story about their life.
Yeah.
You notice a certain way their teeth are wearing, it's like, this person maybe has had a stressful life or maybe is going through something stressful. They
You're like
seem
a
to be
detective.
grinding. Yeah, I am a detective. Like I can see that maybe they grind a lot as a way to kind of cope with stress. I do it.
Mm,
And I can see that right off the bat. As soon as they open their mouth, I'm like, yep, he's a grinder. Maybe dealing with stress
wow.
that he or she doesn't even know about. Because they
Yeah.
work at night. How would they know? They're asleep.
No, that's so true. Wow. Okay. So, do you have any other like science-y things you want to talk about before I get to like some more fun questions?
Sciencey things.
Like maybe if there's one thing that people take from this, what do you hope that they take from what the conversation we've had thus far?
Yeah. Um, I think that one of the big things is just realizing how connected the oral cavity is to the whole body. And
Mm,
I think oftentimes people in their minds separate dentistry and their teeth and the health of their mouth and they
for
separate
sure.
body. And I think that's really doing you a disservice when you realize, okay, maybe I'm feeling really stressed out and yeah, I don't know. It's important to kind of think it all as one thing, and not to believe everything that you see in the media about all of these trends.
That's
Oh,
you're segueing so great. I want to talk about science misinformation.
yeah,
And
a lot out there. There's a lot, and it's really scary.
so, okay, so tell me from your perspective, what is the worst dental advice or trend that you've seen on social media?
The worst dental advice or trend I've seen on social media. I actually had to do a presentation on one,
Oh,
and the one of them that I want to bring up is this whole thing with charcoal. Um,
I've
you
used
talk about charcoal?
I've used charcoal too.
Oh yeah. Oh yeah. Listen, okay. Charcoal's great. I'm not going to sit here and bash charcoal. There are so many charcoal has been used in ancient civilized, like again,
Yeah.
did a presentation on this. There are uses for charcoal. I don't
Mm,
want to sit here and say charcoal's bad. Don't ever use charcoal in anything. No, there's amazing uses in charcoal.
mm.
But but there's not really any good use of charcoal in the oral cavity.
Really?
So, and I'll expand on that a little bit more. And bear with me because I did this presentation about a year and a half ago. So, just work with me here. Historically, charcoal has the ability to kind of draw things out. And what I mean by that is detoxify. And a lot of times in old cultures, back in ancient times, there's ways to use charcoal for what it benefits for. And, drawing things out is one of them. However, the oral cavity is very different than um than how charcoal the effects of charcoal in the oral cavity is different. So from what I understand and what I've seen in the media is people love having white teeth, right? That's that's just what
People love having white. I like having white teeth.
I mean, who doesn't love having white teeth? I
A
want,
nice white smile is great.
yeah, a nice white smile is amazing. Like I, yeah, I am a support of if people like whitening their teeth, there's benefits to that and there's specific ways to go about that. But charcoal is just not one of them. For
Mm,
example,
mm.
in the teeth, right? There are what's called an enamel and it's what's called dentin. And what people think charcoal does is kind of like uh suck out all the stains from their teeth, is
Yeah.
what I'm assuming, right? Like well, you tell me, when you think of charcoal, what do
Yeah.
you what do you think the effects are in the oral cavity? What
Or
do you
like
think?
why did I get why did I get charcoal? Because I wanted whiter teeth. And I saw all these people doing
Okay.
this stuff and they have charcoal and then they talk about
Mm.
how charcoal pulls out stuff. So exactly what you said. I'm like, "Oh, well if there's stains or if there's like over time it's just gonna like pull out the bad color and make it white." That's what I Listen,
Yeah.
that's what I thought.
Yeah. And so there's nothing wrong in thinking that. But when it comes to teeth,
That's
what
not how it works.
actually, that's not quite how it works. Yeah. But
That's
that's
okay.
okay. I mean, people, the more you learn, you know what they say, you got to go out and learn. Don't
Facts.
listen to what the masses are telling you. Do your own research to figure out what's happening to your body and the world. I'm a big
Yes.
fan of that. With teeth, though,
Mm,
what actually causes the staining is a deeper tissue called the dentin.
mm.
So when you look at someone's teeth, what you're really seeing is the enamel, and then you see the dentin behind it. So the
Oh.
dentin is what actually absorbs color and staining. It's not the enamel. The enamel is translucent. The enamel,
Ah.
so charcoal has the ability to draw out impurities and whatnot, but you're talking about penetrating the hardest structure in the body.
Yeah.
And is harder than bone. It is the
I
strongest,
didn't know that.
strongest. It is stronger than bone. It is the strongest.
Enamel said.
Enamel said, "Play around." They said, "Don't play." So you you want to sit and think, okay, is charcoal going to one, penetrate enamel, the hardest material in your body, and then
Mm.
somehow make its way into the dentin, absorb all of the staining, and then, oh wait, makes it out of the enamel, back out with the stain,
All in 2 minutes.
all in brushing for 2 minutes. It's
Yeah.
not a lot of people don't even brush twice a day.
Yeah. That's a good point.
It doesn't happen. It just
Yeah.
doesn't happen. It is a very, I will say, very well marketed um thing that they
Yeah.
did.
But
They
but that's exactly what it is. It's marketing. And they
marketing.
marketed it well, but
They
in
marketed so.
actuality, it's not actually the cause. I'm going off on this much of a tangent.
Mhm.
I was in one of my classes and I'm getting my MPH people, for those of you who don't know me.
Amazing.
And they were talking about, what'd you say?
I said amazing.
Thanks.
Get
Um,
girl.
and they were talking about um, vitamins, like the vitamins that they sell at CVS, the vitamins that they sell, prenatal vitamins that they sell to women. And this is coming from a woman who has her doctorate specifically in nutrition during the first 1,000 days of a woman's pregnancy journey. And there is so much of a lack of regulation for vitamins. And I'm assuming for toothpaste and toothbrush and charcoal. And this lack of regulation allows these companies to put what they want in things and they're not required to like tell you like they can do false advertisement is what I'm trying to say. So at CVS, they'll say, okay, this is your prenatal vitamin. And some women will go or birthing people may go in there and say, hey, I know I'm pregnant. Let me be healthy. Let me be proactive and get this prenatal. But what's so crappy is that these prenatals don't have the levels and or all the nutrients you need in it. So you're not actually some of them don't even have folic acid, which is one of the main exactly, which is one of the main vitamins. You know this.
That's
Like
so. Oh,
it's wild.
can I just say we have enough. Am I allowed to curse on here?
Sure, we can bleep it out. We can edit it
Okay.
out if we're not. We'll ask D to edit it out if we don't need it.
Okay,
Go ahead.
okay. Well, we have enough to deal with in this world. You
Yes.
want to sit here and tell me I'm trying to take good vitamins and be healthy, and I go to the grocery store, and it's not what I'm buying and what I'm spending my hard-earned money for is not what it's advertised to be, and not even including the correct vitamins that actually make me be healthy.
And go into
That's
the
exhausting.
go into the it's exhausting, bro.
It's exhausting because you want to have that trust where it's like, okay, I'm trying to better my health here.
Mm-hmm.
You go to the grocery store, you go to the drugstore, you go wherever you want to go, and you'll feel
Mm-hmm.
overwhelmed with 50 options for toothpaste. I'm just going back to toothpaste here, or
Yeah.
50 options for prenatal vitamins. And you're sitting there and you're trying to decide what am I going to pick? And then again, it's what you said. Sometimes what's advertised, most of the time, I will say, it's not even what you're going to be getting.
I know.
That's crazy to
It's
me.
frustrating. No, it's so frustrating. And I actually think I want to do a tangent again. I think I want to do my thesis on this topic because I think it's I don't I just need to look into it more, but I think it's a huge issue having medicine or not vitamins, minerals, toothpaste, like those type of things in the marketplace where people advertise to sell their product versus make sure that their product actually treats and heals and prevents what it's supposed to. The preventative care market, I think, is messed up.
Oh yeah, I
Um,
agree.
anyway, let me pull us back. Let me pull us back. Okay. I'm gonna ask you one more fun question.
Okay.
And yeah, so have you ever had a funny or embarrassing moment as a dental student that you would like to share with us, or as a dentist in clinic that you would want to share?
yes. Oh God. Uh, yes. And I'm going to tell you the story because I think it goes to show and will hopefully inspire people if they are, um, you got to do things even though you're scared.
Mm.
And I'll get to that. And I don't mean to be philosophical, but I also do mean to be philosophical. I I mean, there's so many times where I don't know what I'm doing entirely. I know what the goal is, but the in between steps can be very blurry and gray.
Mm.
But you have to do it anyway because you have to learn. You have to
Mm.
zone and push yourself to be better and to learn. That's the only way. Like if you're stuck in like reading the same articles and reading the same, listening to the same podcasts or like, and what am I trying to get at? Doing things that make you uncomfortable sometimes are like the biggest blessing. And I wanted to preface that because I'm going to tell my story.
Okay, let's hear your story.
So, a patient's in my chair and um we are doing what's prepared. I'm preparing for it's called a cast partial. So she's missing certain teeth in her mouth, not all the teeth, but certain
Hmm.
teeth,
Hmm.
and make a metal housing with fake teeth to fill in the gaps essentially, and that's called a partial denture. Um, one of the steps of doing a partial denture, there's so many steps, because think about it, you're creating a framework that specifically fits that person's anatomy,
Mm.
um, and makes it functional for them to chew and eat and smile and whatnot. Anyway, one of those steps is getting what's called a bite registration.
Okay.
Okay. A bite registration. So it's kind of self-explanatory, but essentially what you're doing is you're trying to register what that person's bite looks like.
Okay.
So what we do is we have what's called this blue mousse. And
Oh, I've seen it. It's the stuff that they put in the thing. And
yes,
then,
yes, so yes, it's a little different, but yes.
okay.
We only put it like right here and right here
Hmm.
to get like the bite registration.
Okay.
Anyway, it's mind you, our sessions are 3 hours. It's about hour two and a half. Okay. It's been a long visit. You know,
Yeah.
my patient's really sensitive. It was a long visit. And
Okay.
the last thing that I needed to do was to get my patient's bite registration.
Okay.
So I go to the what's called the garage. It's in
Hmm.
clinic, it has everything like all dental materials that
Your
we go
supply closet.
get. Our supply closet,
Yeah.
exactly. I go and I get what I think is the bite registration material. Okay.
Okay.
So I get it. It's a blue color material. In my mind, we call it blue mousse. So I go to the garage and I get what's I think is the blue mousse.
Oh
But
no.
there's other material that are blue. Okay. So keep that in mind. My patient doesn't speak English. Okay. So I'm already communicating via translator. So things are
Okay.
kind of a bit lost in translation
Yeah.
to begin with. I get my blue mousse and I'm like, okay, this is going to be quick. It sets in 2 seconds. And when I mean set, I mean it goes from like this doughy material, liquidy dough
Hmm.
material to like a firm consistency
Hmm.
within seconds. Okay. So I load it up in the ejector and I'm like, 2 seconds, we'll be out of here. Lock it into place. I say, open. The patient opens, and I
Hmm.
squirt. Again, I'm gonna cuss. Ton here, and I
Okay.
squirt ton here.
Yeah.
And as I'm squirting out the material, I notice that's not bite registration. That's not what I. That's not what I thought it was. It is
Whoa.
was a heavy body or light body PVS material, which is it takes like 10 minutes to set, or
Oh
not, but five
no.
minutes, like 5 minutes to set. So I'm, mind you, I just want to set the scene here. We're 2.5 hours in. Okay.
Yeah.
This is supposed to take 2 seconds. I'm squirting this material all over my patient's mouth.
It's gonna
It's
take more.
It's turning all her cheek this blue color. I'm like, in my mind, I'm like, what did I just do? I'm gonna have to wipe this all over. Like, I'm just like, oh my God, this is not bite registration.
Yeah.
I open and I'm like, let me just give me 1 second. I'm just gonna go grab some like wet paper towels. And mind you, Tosi, I'm literally in her mouth wiping, wiping this material, trying to get it out of her mouth before the material sets. And it's just like she ate like a tub of blue icing.
Oh no.
That's the best way that I could explain it is that I essentially like put all this material into this patient's mouth that I thought it was bite registration material and it wasn't. And now I'm
Yeah.
like trying to wipe all of this stuff out of her mouth. It's been 2 hours in. She
Yeah.
doesn't speak my language. She's already annoyed with me because we couldn't get done what we wanted to get done that day. And I just was like, this is just a disaster. Like,
Yeah.
this is just so terrible. But you know what mistake I'm never going to make again? Is choosing the wrong material because I'm going to read
Facts.
it before I choose it and I bring it back to my bay. So that's just like one of the funny things that I just was like,
Yeah.
I have other stories, but that one stuck with me because I felt so terrible. She left with like a whole bunch of blue all over her mouth.
Yeah.
It happened. And now I'm like, oh gosh, I don't want her to think that I don't know what I'm doing. I know
Yeah.
what I'm doing. It's just there's so many different things to keep in mind. And like that's one thing that I hold very close to my heart is my trust with my patients.
Yeah.
That trust with their provider. And I felt like I just like
You
I
lost a
was
bit
like,
of
oh,
trust. You felt like you lost a bit of trust then.
I felt like I did because she's like, well, how can she trust me if I don't even know if I'm using the correct material sometimes?
Yeah, you're putting
It was,
yourself.
yeah, it was an honest mistake. It happens, not a big deal.
Yeah.
But
Yeah.
one of those things where it's like, yeah, I don't know, just funny.
No, that was a good story. That was a good story. And I think this conversation of doctors holding trust with their patients to the highest esteem is so important. So I'm really glad that you said that. And um, going back to you, you are a dental student, but you are working on patients and they kind of like throw you into the fire a little bit. Like I remember you calling me being like, Tosi, they're just throwing me in.
Just throw
Like
you in.
they're just throwing me in. But to your point, you have to, and this is kind of like a life lesson, you have to go in and learn things that you're uncomfortable doing. Like you just have to do it. And it's repetition, right? That's a lot of tell me if this is correct or if this is wrong, but I feel like dentistry is a lot of repetition. And the more you repeat it, the more comfortable you get, the faster you get, the more efficient you get, right?
Right. Oh, absolutely.
Yeah.
Absolutely. It's a repetition and different procedures, and you have to kind of allow yourself to learn. And sometimes
Mm,
the best way you can learn is by failing. And
mm,
and I think our society looks at failing so negatively.
yeah,
I don't think it should be looked at negatively. I think that
I agree.
failing is inevitable. It happens.
Mm,
Why are we so scared of failing? You're gonna
mm,
fail. It's okay. Doesn't mean it makes you less of a person. But what failing does is it teaches you. It teaches you,
yeah.
okay, next time if I'm faced with that same issue or
Hmm.
maybe in a different scenario, I know how to handle that because I handled it before. It also creates confidence.
Yeah. What's the saying? The faster you fail, the faster you succeed. Something like that.
Yes,
Like fail fast, succeed fast.
yes. Fail fast, succeed fast. Welcome it
Mhm.
with open arms. Don't be
Yeah.
scared of it. Don't be adverse to it. It's going to
Yeah.
happen anyway. There's going to be things in life that you make a mistake and you fail in, and then
You
that's
learn
just what
from it.
you learn from it. Yeah.
Yeah. Oh, well, that's a good note to kind of end things on. This has been so fun. I want to do this again.
I know we should do this again. I felt like I had to put on my scientific doctor hat, but
You did a little bit.
there's some other fun stories that I can talk to you about. One of the
Yeah.
stories about my oral surgery rotation that we should remember, there was a patient that was just like absolutely terrified.
Oh.
terrified. And if there's time, I don't know how much time we have left. I
You
want
go
to
ahead.
that up. Oh
Go
my
ahead.
gosh, guys, there was in dental school we have rotations, and I was on my oral surgery rotation, and that's essentially where we pull teeth and um, sometimes they're surgical. We have to get into the bone and drill out bone around the tooth. Anyway,
Hmm.
oral surgery. There's a lot going on. This patient comes in, her face is swollen,
Oh
like
no.
I'm talking like it looked like it was just so big. And she had a tooth that was decayed so severely that it made its way to the root,
Mm.
and infection that was
Mm-mm.
spreading. So, like I said before, it's all
Is this a
connected.
gruesome story?
No,
Okay, that's the
um,
gruesome of it all. Okay.
that's the gruesome of it all. It's like
Okay.
there's infection, and it was just really big. She
Hmm.
came to the hospital at BMC, so that's where we do part of our rotation is at BMC. And when I tell you guys, she was terrified, started crying. I'm the first person that walks in as a dental student. I'm the first one that comes in, and
Hmm.
I need to see what's going on with them. And the attending will come in, and then I present the case, and I say, this person's having XYZ on X2. Okay. So I walk in and I said, "Hey, I'm Ladé. I'm a third-year dental student. Tell me what's going on today." Tears.
Mm.
Oh, no, I've had this happening. Like, she was saying basically how she's been to so many different dental offices and no one's been able to get her numb. And her tooth is in so much pain. She knows that there's an infection going on, but she's terrified. And
Yeah.
she's like, people just aren't getting me numb. And I don't know what's going on, but I need this tooth to come out.
And mouth pain is like one of the worst pains. I remember
Oh,
mom, she literally said that she would rather give birth again than have the pain that she's had in her mouth.
it is a different, I'm telling y'all right now, it is a different type of pain.
Yeah.
And luckily, I haven't had to deal with it, but I could tell just by walking in and looking at this poor woman, she was in so much discomfort.
Yeah.
And I just said, "Okay, so talk to me. How did you get here? How did this happen?" And she was
Hmm.
like, "Well, I've been to one in her, I think she was like living an hour away. She went to a bunch of local dentists, and basically they weren't able to get her numb, and this was her last stop shop. And that's often
Mm.
hospitals is, especially at BMC, is this is the people's last resort.
Yeah.
We can't go anywhere else. This
Yeah.
is they go." So I'm talking to her and we're chit-chatting. The attendings are running behind. It's a busy clinic. And we start talking about her life. And I mean, the things that this woman has gone through, like domestic violence. And I don't want to, get too much into it, but she's dealing with so much personal issues. It broke my
Mm.
heart because she's like, I've been waiting to get this tooth out because I'm trying to move away from my partner and my kids. I
Oh.
want to into a better school. We want to go to Florida and be by the water. And I can't, my insurance, I haven't figured it out in the new state. So I'm trying to get this done before I go. But everywhere I go, they can't take care of me.
Oh my gosh.
So she's trying to get this done because she wants to move with her child, her two children out
Mm.
away from this toxic environment. But
Hmm.
she can't leave because her insurance situation in the new state, she doesn't have that figured out yet. So she's like, I have to get it done in the state, but like
Yeah.
everywhere I've gone, they haven't been able to do it. And I'm like, okay. And so I just sat and I talked with her. And I talked to her about my life. I talked to her about my struggles. I talked to her about, you know, pretty much like I don't know. I felt really connected to her. And eventually
Yeah.
the attending came in, and the attendings, they're trying to get, excuse my language here, they're trying to get done,
Hmm.
trying to get pull this tooth out. They got six other patients waiting for them that've been waiting for an hour already.
Hmm.
They're, they're like, let's go. Because I've sat with this patient for, I want to say 30-45 minutes waiting for the attending. And it was a surgical extraction, meaning they get out
Mm.
this drill. It's called a handpiece, and you have to carve around the bone. It's a complicated extraction,
Hmm.
and we did it under local, meaning we did it with just injections. We didn't put her under.
Oh
We just
wow.
lidocaine around her tooth, and you take this drill and you're drilling out bone around. So she held my hand during the entire procedure,
Oh.
and I kept rubbing. I said, think about it this way. She was like, I just want my kids to know that I'm strong for them because this is the one thing that's preventing us from leaving. And I'm like,
Oh,
think about your children. If they were here, right here next to you, and they're cheering you on, like, come on, mommy, like, you got it, mommy. And so she sat there and she was
well, I'm
squeezing my,
about to cry.
yeah, I mean, it was really sad because I like, you don't know what people are going through.
Yeah.
You don't know what people are going through. And it is heart-wrenching to hear that the way that this society works is you don't take time for people.
I was just gonna say that.
We
Like,
don't
one
take
is
time for people. We're human.
especially in the medical system.
Yeah,
And so
especially in
the
them.
fact that you sat with her for 45 minutes and just let her and build that rapport with her and let her open up and share and you sharing, I think
Mhm.
that is so beautiful and necessary, especially in the medical system where people are scared and
Yeah,
stuff is happening that they don't know. They can't fix it themselves. They don't know exactly everything that's going on. It's a scary situation.
but guess what? We got that procedure done. We got
Yeah.
that out.
Yeah.
So much better, and she can take her babies and move wherever they need to move. And
Mm,
that all it took was someone just to listen to her. All it
mm,
took is for someone to be like, you know what? Yeah, this is scary. I would be scared if I was in your position.
yeah.
Well, I mean, gosh, she was in so much pain. And what makes it even worse too with infection is it makes it harder for you to get numb
Yeah.
when you have all that infection. So not
Yeah.
only do we have anxiety that we're dealing with, not only does she have pressure at home, not only do we have the all of the being in a hospital, but she has an infection, and that makes it even harder for someone to get numb. So
Yeah.
I held her hand the entire time, and boy, she has a strong grip. Oh my gosh. I had
Yeah.
somebody squeeze my hand that hard, but I was like, girl, scoot your
Yeah.
shoe. And we got it done. And she went about her day. And it was a
Oh,
teachable moment to remember that we're all humans. We're to humanize each other. I think that there's so much separation going on in our country right now. And I don't mean to get
mm,
political, but I also do mean to get political. It is you take people are taking the humanity out of things. And
yeah.
it's really sad. So hopefully
Yeah.
this serves as a reminder at the end of the day, we're all going through the human experience. We're all struggling, whether it be financially, whether it be emotionally, physically. We're all facing things. And if you kind of allow yourself to come down to this human level, be like, you know what? I've been there before.
Yeah.
We're all humans. Like I don't want to judge you or hate on you or be rude. Like
Yeah.
we're human beings. We're going through this struggle together. So anyway,
Exactly. No, that was such a beautiful story. And I feel like as a medical professional, I had my mentor, she's also been was a medical professional for like 20, 30 years. But there's you all have it seems that you all have these patients that stick with you and are kind of your why behind why you do what you do. And to end kind of on a lighter and more positive note, I think that you being this next generation of doctors, of dentists, makes my heart swell and makes me feel and have hope in the medical system that there is not only a person who's looking at you like a human that's going to be this new dentist. She's also a woman. She's also a black woman. And she is here to listen to you and hear you and do the best that she can to make sure that you are comfortable and that your life can move forward. And so
mhm.
I am so proud of you as my sister, that you are taking on this field and that you are so close to being done. And the world's not ready for you. I mean, it is. No, the world's plenty ready. The world needs you now. So hurry it up. Okay. The world needs you
Period.
now. So let's get this degree and then let's go, okay?
And do what needs to be done.
And do what needs to be done, period. Um, well, thank you so much, Lottie. This was so lovely.
Of course. Of course.
Mhm.
I'm honored to be on this podcast and
Yeah.
kind of share a
Oh,
little.
and where can people find you if they want to follow you, or do you want to share that? You don't have to.
Yeah, of course. I do have Instagram and I do have TikTok, but I'm more of like someone that just scrolls on TikTok. I don't really post.
Yeah.
But Instagram, it's my first name, Lade, Lade, and then my last name, Adeni. But at the very end, there's two Y's and two I's. So Lade Adeni with two I's and two I's at the very end. So if you
Perfect.
Instagram, shoot
Yeah,
me.
follow your journey.
Yeah, I would love that.
Ask you questions if they have questions about
Questions.
dentist things.
Yeah, if you have questions about dental, oral cavity, what products to use, what research shows. My school is really, really research heavy. So it's good to do your own research, folks, before you
Period.
before you you do anything.
Yeah. All right. Well, thank you. And for everyone joining again, I'm Tosi and I'm from Criado. We're a women's wellness nonprofit organization. You can find us at gocriado.org, GOCRIADO.org, and at Go Criado on all other platforms. Thank you.